What's up, guys? It's Luke, and I've spent a year and a half trying to improve my seasonal and year-round allergies, and I'm going to rank all the different treatment types I've tried to share with you what's worked for me. Okay, here's an overview of what I'm going to cover, and I have links in the description. Topic 1, skin allergy testing. Topic 2, allergy treatments. I'm going to cover A, allergy shots, B, antihistamines and nasal sprays, C, ClearUP electronic device, D, Mucinex, E, Neti Pot, F, intermittent fasting, and G, eating honey. Topic 3, other helpful tips like enclosing your mattress and pillow. And Topic 4, end summary and my daily routine. Topic 1, skin allergy testing. Okay, so how do you know if you have seasonal allergies like tree pollen or grass, or year-round allergies like cats or dust mites? Well, allergies occur when your immune system overreacts to these substances as if you're being attacked by a virus or harmful bacteria, and your body responds with inflammation of nasal tissue and a runny nose or post-nasal drip or sneezing and watery eyes. For me, I get a post-nasal drip that puts mucus in my throat and on my vocal cords, and then I can't sing correctly and do the things that I love to do, like music. So if you have these symptoms, you can go to an ear, nose, throat doctor and get a skin allergy test to see what you're allergic to. Here's a picture of my arm after I got a skin allergy test. What they do is dip a plastic piece with 8 points on it into a tray of liquid vials of known allergens, and they push it on your skin. And they repeat this with several different trays. You can see on my arm where they use marker to mark the location and number of each tray. Then they wait 15 minutes and look to see what you reacted to. They use a ruler to measure what's called the wheal and the flare of each test point. The wheal looks like a mosquito bite, and the flare is the red splotch around it. If either the wheal or the flare is 10 millimeters or greater, they consider you to have an allergy to that substance. So here's the different types of allergens that they tested me for, which included categories such as animals, dust mites, spring tree pollen, summer grass, fall weeds, molds, and the bottom trays are foods, but it's worth noting that it's still a skin allergy test. It's not a food allergy test. Alright, here's my results, and I have it color-coded. My strong allergies in red were dust mites and Kentucky bluegrass, and you can see the mosquito bite wheals and red flares on my arm. And if you're wondering what dust mites are, they're microscopic bugs on your pillow and bedding that eat dead skin cells. Next, I had moderate allergies in orange to birch tree pollen, Bermuda grass, and a couple weeds, and then I had several different mild allergies shown in yellow. So that's how skin allergy testing works and how they use it to determine what you're allergic to and what the severity level is. Topic 2, allergy treatments. A, allergy shots. Allergy shots, or immunotherapy, is an allergy treatment method where they inject you with shots of the substances you're allergic to. They may sound a bit concerning, but they start off with low doses and build up slowly over time. The goal is to make your immune system less sensitive to the allergens to try to reduce the severity of your allergies. Okay, in the last section we covered skin allergy testing. If you get a skin test, it will show which items you're allergic to. Then they can make you vials of custom serum containing those specific allergens. It comes in 2 forms. 1, drops that you put under your tongue at home, or 2, shots that they inject into your arm at the doctor's office. For me, I get the allergy shots because they might be more effective. When they made my vials, there was 5 different bottles for different groups of allergens that I was allergic to. So for me, each allergy treatment is 5 shots. I think 5 might be the maximum, but you can have less shots if you're allergic to less things. They also make 4 different sets of the bottles: green, blue, yellow, and red, which have increasing concentrations, so the dosage of your allergy shots can be increased over time. Okay, so for weekly allergy shots, here's what the dosage by week looks like. The x-axis has weeks 1, 2, 3, etc., and the y-axis has the volume of allergen serum in the shot. They started me off with the green bottles, which were diluted 1,000 to 1. The volume of the shot starts at 0.05 ml, and they go up each week, 0.10, 0.15, 0.20 ml, until you get to 0.50 milliliters, and then you jump over to the next color bottle. But when you factor in the 1,000 to 1 dilution in the green bottles, you can see the volume of allergen serum in the shot is really low. Okay, after the green bottles, you move to the blue bottles, which are 10 times stronger, with the dilution reduced to 100 to 1. But again, after the dilution, the shots still contain very low levels of allergen serum. I don't think I reacted much at all to the green or the blue bottles. Next, you move over to yellow bottles. They're again 10 times stronger, with the dilution reduced to 10 to 1. Here's where the shots start to have a noticeable amount of allergen serum on the chart. And by this point, I was definitely reacting to the shots with red splotches on my arm for a few hours. Finally, you get to red bottles, which are 10 times stronger with a dilution of 1 to 1, which means they're not diluted at all. 1 ml of shot contains 1 ml of allergen serum, and thus it's pure allergen serum. So the red bottles are where the shots start to burn. And people will ask, do allergy shots hurt? The needle doesn't hurt because it's very thin, but when you get to the red bottles of pure allergen, it does sting. The goal is to get to the maintenance dose, which is 0.50 ml of the red bottles. The first time you reach the maintenance dose, it stings the most, but the good news is that it stings a little less each week after that, as your body continues to become less sensitive to the allergens. So that's 40 weeks on the schedule, but if your skin gets really red at any point, they don't always bump you up the next week, so you might repeat some doses. For me, it took about 42 weeks, which was from January to early October, to get up to the maintenance dose. After completing a year of weekly shots, they moved me to bi-weekly shots in year 2, and when I get to year 3, it will be 6 months of tri-weekly shots, followed by 6 months of monthly shots. Alright, so here's some video of me going in for my bi-weekly allergy shots in March 2021, or about 5 months after I hit the maintenance dose, and there's definitely less stinging and lower reaction compared to when I first hit the maintenance dose. So I couldn't get permission to film the actual shots, but this is what my arms look like 5 minutes after the injections. You can see there's 3 shots in my left arm. They look a little bit puffy. We're turned here to the right. There's 2 shots in my right arm. The top one contains dust mites, which is my worst allergy, and the bottom one I'm not even reacting to. This next clip is 40 minutes after the shots in the parking lot outside. You can still see some red splotches, but the swelling is already going down. On the right arm, same thing with just some redness on the skin. Okay, one more clip. This is at home 2 hours after the shots. You can see left arm, only a little bit of redness left. Then on the right arm, a bigger pink spot, but it's already fading. Alright, so that's allergy shots. And as I go through the different allergy treatment types, I'm going to fill out this summary table with my rating of their effectiveness and the pricing and other info. So for allergy shots, on a scale of 0 to 10, I give them a 6, meaning I feel like allergy shots cut my symptoms by more than half, something like 60%. So it's not a 9 or a 10 because I am not cured. But for me, cutting my symptoms by more than half is huge because the allergies can make you miserable, so I'm very happy that I got allergy shots. Okay, pricing for allergy shots depends on your health insurance. You can see in the table I have a note A at the bottom that my medical insurance is Blue Cross Blue Shield in the United States, and the 2021 rates are a $94 copay for the initial ENT doctor's visit. Then the allergy shots are no cost for the vials and the weekly office visits. However, if I had gone with drops under the tongue instead of shots, it would have been $300 every 3 months for the drops. The last column that I have in the table is medical reference info on the treatment type. I'm citing the Mayo Clinic here, and on their website they state that allergy shots can be used to control symptoms triggered by seasonal allergies. Topic 2, Allergy Treatments. B, antihistamine and nasal sprays. Antihistamine pills and nasal sprays are among the most common ways of treating allergies because they can help with allergy symptoms, and many are available over the counter where you don't need a prescription. As far as how they work, when you have a reaction to an allergen, there's a type of white blood cell called mast cells that release histamine. That's like a chemical warning alarm that yells intruder, and the body reacts with inflammation and nasal drip trying to expel the intruder. But the problem with allergies is it's a false alarm. The antihistamine pills work to block the effect of the histamine and thereby reduce the allergy symptoms. Here's some of the antihistamine pills that I have in my house right now. Benadryl is first generation antihistamine, so it can make you sleepy. Claritin, Zyrtec, and also Allegra are second generation and they don't make you sleepy. Another popular item is steroid nasal sprays such as Flonase or Nasacort. They contain a corticosteroid which works to reduce inflammation of the nasal tissue. There's also some nasal sprays that contain a decongestant rather than a steroid, such as Afrin. I personally haven't taken Afrin, but decongestants work to reduce congestion by narrowing the blood vessels in your nasal tissue. With any of the medicines, you want to read the directions because some can be taken long-term, but others cannot. For example, with Afrin, you're not supposed to take it more than 3 days in a row, otherwise you may get rebound congestion when you stop. Okay, there's also combination medicines, and that's what my ENT doctor prescribed for me. He gave me the generic version of Dymista, which is a combination of an antihistamine and a steroid in one nasal spray. In the US, Dymista is available by prescription, not over the counter, but it would be similar to taking an over-the-counter antihistamine plus a steroid nasal spray. Okay, so here's my summary table with item B for antihistamine and nasal sprays. For me, on a 0 to 10 scale, my rating is a 4, meaning antihistamine and nasal sprays improve my allergy symptoms by about 40%. But it's also interesting to note, if we look on Amazon, all of these products, Zyrtec, Claritin, Allegra, Benadryl, Flonase, Nasacort, get a high score of around 4.8 out of 5. So my instinct is that your score will depend on how severe your allergies are. If your allergies are not as severe as mine and you don't need allergy shots, you might find that you would give these medications a higher score than the 4 that I gave them. If I'm taking an over-the-counter antihistamine, I'll probably take Zyrtec, and for an over-the-counter nasal spray, I'll probably take Flonase, but I think all of the popular brands are similar, so I really don't recommend one brand over another. On pricing, the price is variable depending on which item you buy, but antihistamines and nasal sprays can be a little bit expensive. Generics will be less expensive. On the medical reference info, the Mayo Clinic states antihistamines block histamine and can ease allergy symptoms, and corticosteroid nasal sprays can suppress inflammation from allergies. Topic 2, Allergy Treatments. C, ClearUP electronic device. The ClearUP electronic device is relatively new. It came out in 2019. I first heard about it when it made Time Magazine's list of 100 best inventions of 2019. It received U.S. Food and Drug Administration (FDA) approval for treatment of sinus pain. Then in 2021, the FDA expanded the approval to include treatment of congestion, which includes from allergies, which is the reason I use it. So here's a look at it. It's an electronic device. You push the button once to turn it on, and then you can push the button again to change between one of 3 intensity levels shown by the 3 lights. What you do with it is you put the tip of the device on your cheek, and it produces a low-level current that runs into your nasal tissue and down a path that goes back through your arm and into the device to make a circuit. The gentle microcurrent can temporarily reduce inflammation of nasal tissue and decrease congestion and postnasal drip. You move the tip along this C-shaped pattern on each side of your face to apply the device to your nasal tissue and sinuses. As you are moving the device, each time it hits a point with lower impedance and more nerves beneath the skin, the device vibrates for 7 seconds to tell you to hold it there, and then you can move it along to the next treatment point. You alternate sides as you move along the C-shaped pattern, and one session consists of using the device for 5 minutes, and you can use the device up to 4 times a day. Okay, so back to our summary table. In row C, I give the ClearUP device a 4 on a scale of 0 to 10, meaning it seems to reduce my allergy congestion by about 40%. So for me, putting it in a similar range as antihistamines and nasal sprays. Each treatment type seems to calm down my nasal drip for about 4 hours, sometimes a little more or less, but you can use the device up to 4 times a day. And I find that sometimes when I eat a meal, it seems like it turns the nasal drip back on, so I like to use the device for a quick 5-minute treatment before I eat to help keep the nasal tissue calm. For the price, the device is currently selling for $129 US. It's not cheap, but it'll probably last several years as it comes with a cord and you just keep recharging it. And when I compare that to how much you might pay for antihistamines or nasal sprays for a year or 2, to me it's definitely worth it. Finally, the medical reference info, nothing from the Mayo Clinic on this one, but the U.S. Food and Drug Administration approved the ClearUP device for treatment of congestion and sinus pain. Topic 2, Allergy Treatments, D, Mucinex. So the previous allergy treatment types I've covered, including allergy shots, antihistamine, ClearUP device, are all designed to reduce your reactions to pollen and other allergens as part of the front end of an allergy treatment plan. And as I showed in the summary table with my scores, they all do help. But unfortunately, none of them cure me 100% with my allergies, so I always still have some level of postnasal drip and issues with mucus on my vocal cords. So that's where Mucinex comes in. For me, it's the back end of my allergy treatment plan as to how do I deal with the mucus on my vocal cords that still gets through. This is what a box of Mucinex tablets looks like, and you can also buy it under its generic name, which is guaifenesin. Here's a generic bottle of guaifenesin, and I even like how they label it mucus relief. So guaifenesin is an expectorant, meaning it helps you expel mucus by making it less thick and viscous and more thin and fluid. The maximum dose per day is 2,400 milligrams, which is 2 of these max strength Mucinex tablets, or 6 of these generic 400 milligram tablets. If you take it on an empty stomach, take it with a little milk, otherwise it might upset your stomach. Now the key to guaifenesin is that it doesn't work unless you're very hydrated, so you need to drink plenty of water. If you want to see if you are hydrated, just look at the color of your urine. On this chart, if you're in the 1 to 3 color range, you're hydrated. If you're in the 4 to 7 range, you're dehydrated. For me, I aim for about a 2 by drinking a lot of water, and I also switch my coffee to decaf. And then I know the guaifenesin will work and that it'll thin out the mucus. For vocal cords specifically, in addition to internal hydration, I like to use external hydration by using a steam inhaler. Here's one that I like that I bought off Amazon for $28 US, and I find it soothing to inhale the steam. Okay, back to our summary table. On row D for Mucinex or guaifenesin, on a scale of 0 to 10, I give it a 4, like the last 2 items, that it improves my allergy symptoms by about 40%. And for me, the Mucinex is important because it treats the mucus on the back end and complements the other allergy treatments that reduce symptoms on the front end, and I feel like I need both. Between the brand name Mucinex and the generic, I like the Mucinex tablets better because they have a bi-layer tablet with a quick release layer and a slow release layer to give you a more even amount of medicine in your system over several hours. For the price, this box of 42 tablets of Mucinex maximum strength is $21 US, and this generic bottle of 200 pills of 400 milligram guaifenesin tablets is $10. And on the medical reference info, the Mayo Clinic states drinking plenty of water while taking guaifenesin may help loosen mucus. Topic 2, Allergy Treatments, E, Neti Pot. The Neti Pot originally came from India, and it's popular in parts of Asia, and it's becoming more common in other parts of the world as well. It's used to pour water in one nostril and out the other to rinse your nasal passages. This could help with allergies because it may loosen mucus and flush out allergens such as pollen. The first thing to mention is that you should either buy distilled water or boil tap water before using it in your Neti Pot. The reason is there is an amoeba found in warm lake water that is possible could be in tap water, which can pass up your nasal passage into your brain and cause a deadly infection as it eats away at your brain. The actual number of cases is very low. Here's a map of the United States with cases per state totals to date. Texas and Florida have the most cases, and these are predominantly people who swam in lakes and not Neti Pot users, but I'm in North Carolina where we do have cases, so I'm not taking any chances. So I like to boil a pot of water, and after it cools down, I pour it into a pitcher so that I have sterilized water ready to go for the week. To use your Neti Pot, you first want to mix 3 parts of salt. Use non-iodized salt because you don't need iodine in your nose. And add 1 part of baking soda, and then mix it all up together well. Then you only need a little bit, 1/32 of a teaspoon or 0.16 milliliters, and drop it into your Neti Pot. This is to make the water into a saline solution, otherwise without it, the water will burn a bit. Then pour in your water halfway. Give it a shake to dissolve the salt, and then fill it up. Alright, then put the Neti Pot in one nostril. Make sure you tilt your head down toward the sink, and the water will flow out of the other nostril. It does take a little getting used to. When you're done, you just blow the water out. Then you want to repeat this on the other side. You can either do half the Neti Pot on each side or a full Neti Pot on each side, whatever you prefer. And as long as you use the salt and baking soda, it won't burn after you do it once or twice. And again, blow the water out. Then as soon as you're done, blow your nose, and that's when it really feels like the mucus is cleared out. Your nose will feel great, and it's very clear and easy to breathe. Okay, here's our summary table. For the Neti Pot, on a scale of 0 to 10, I give it a 2. I really like the Neti Pot, and I use it every morning. I feel like it really clears out my nose to start the day, but I feel like it does not stop my allergies the rest of the day, so that's why I don't give it a higher score. For the price, you can get a Neti Pot for less than $15 US. I like ceramic ones. I don't like the plastic ones. Here's the one in the video. It's $11 on Amazon. And here's another one that I just got that holds a little more water for $14. And the medical reference info. The Mayo Clinic states that the Neti Pot is designed to rinse mucus from your nasal cavity. You might use it to treat your allergy symptoms. Topic 2, Allergy Treatments. F, intermittent fasting. Intermittent fasting is a less common method for treating allergies, but there have been some people who report that it's helpful, so I wanted to see what it would do. And there's some evidence that fasting can reduce inflammation, which could be beneficial for allergies and nasal drip. There's many people who follow intermittent fasting, but the majority do it for other health benefits, such as maintaining a healthy weight, improve cellular repair, or lower risk of diabetes, etc. Now there's several different versions of intermittent fasting. For example, there's a 5-2 plan where you eat normally for 5 days of the week, and then you eat only 500 or 600 calories for 2 days of the week. But to me that's a bit extreme, and what makes the most sense to me is to keep your body on the same routine every day to make it easier for your body to get acclimated to the routine. So there's another version called the 16-8 plan that I think is the best one, and it consists of fasting for 16 hours a day and eating 8 hours a day. This is what I... You want to be in the video, buddy? This is what I follow, and it just means that I'll eat a late breakfast at 10 a.m., then lunch, a snack in the afternoon, then dinner between 5 and 6 p.m., and then you stop eating after dinner and no more food until breakfast the next day. No food till breakfast, okay? And I'm not perfect. I've been known to raid the ice cream in the evening, but the majority of the days I do follow this plan. Okay, looking at our summary table, on a scale of 0 to 10, I rate intermittent fasting as a 2. When I'm in the fasting hours, it does feel like the nasal drip is lower, and after I eat meals, especially dinner, it often feels like there's more nasal drip. But to me, it's in a similar range as the Neti Pot, where it does have benefit, but it doesn't work to control your allergies throughout the day, and you still got to eat. But I still follow 16-8 intermittent fasting, both for the other health benefits and for the modest allergy benefit that it provides for me. The price is good, it's free. And looking at the medical reference info, the Mayo Clinic states that some research suggests intermittent fasting may reduce inflammation. Where'd you go, Rocky? Topic 2, Allergy Treatments. G, eating honey. This is an item that I've heard many people mention, that they eat honey, especially local unfiltered honey, to try to reduce seasonal allergies as the honey contains some pollen. So I guess the strategy is similar to allergy shots, where you try to take in pollen to try to get your body acclimated or desensitized to the pollen. Here's a look at the honey that I buy. It's unfiltered and it's from the U.S. Southeast region, and if we turn it around, there's a map on the back, and this includes North Carolina, which is where I live. So we'll go right to the summary table. From 0 to 10, I rank honey as 0 as far as an allergy treatment method. I love honey, and for singing, I feel like drinking a lot of water and eating a few sips of honey is very soothing on the throat. But I don't notice any improvement in my allergy symptoms. My understanding is that unfiltered honey contains some pollen, but the amounts may be low, and it's mainly flower pollen from the bees, and people are generally allergic to tree pollen and not so much flower pollen. Okay, the price? Honey is around $7 for a small bottle and about $10 for a larger bottle. And for the medical reference info, the Mayo Clinic states honey probably does not lessen symptoms of seasonal allergies with inconsistent results in clinical studies. Topic 2, Allergy Treatments, H, Acupuncture. Alright, this one is quick. I've occasionally heard of people going for acupuncture for relief from allergies, so I included it as a treatment method. However, I have never tried it. Acupuncture is a form of traditional Chinese medicine where thin sterile needles are inserted into the skin at strategic locations, depending on what the treatment is for, in an attempt to stimulate the nervous system and try to provide health benefits such as pain relief or possibly allergy relief. Going to our summary table, I don't have a score because I've never tried acupuncture. The price seems to be in the range of $75 to $100 per hour, and for the medical reference info, the Mayo Clinic states that acupuncture is considered to be alternative medicine and there's some evidence that acupuncture works. For me personally, it's not a very attractive option because it's relatively expensive and there's not much in the way of clinical studies showing that it works for allergies. If you do want to try it, I would recommend looking at the person's credentials, seeing where they got their training. For example, if they were trained in China, where acupuncture is much more prevalent, that might be a good sign. Topic 3, Other helpful tips. A, enclosing your mattress and pillow. So dust mites are a relatively common allergy, and for me, it's one of my worst allergies. Dust mites are microscopic bugs that live on your pillow and bedding that eat dead skin cells. One strategy you can try to help with your allergies is to reduce your exposure to the allergens. For dust mites, you can buy covers for your mattress and pillow that are a barrier that dust mites can't get through. Here's a look at the mattress cover and pillow covers that I bought on Amazon for $25 US and $16 US. The mattress cover goes completely around your mattress and it has a zipper to close it. I put it beneath the mattress pad and the sheets because the pad and the sheets can go in the washer and dryer, and the high heat in the dryer will kill the dust mites. Here's the pillow cover. Same thing, you put the pillow directly in the cover underneath the pillowcase and zip it closed, and then you wash and dry the pillowcase on high heat. It's a relatively easy way to reduce your exposure to dust mites if that's one of the things that you're allergic to. Topic 3, Other helpful tips. B, sleeping on your left side. As I've mentioned, for me, the biggest issue with allergies is I get a post-nasal drip that drips thick mucus into my throat and onto my vocal cords. If I fall asleep on my back, gravity is pulling the mucus into my throat and it makes it worse. If I sleep on my side, more of the mucus stays in my nose and then I can clear it out in the morning with a Neti Pot. So for me, sleeping on my side is better. To take it further, I like sleeping on my left side. We can see in this diagram, the reason is your stomach is located on your left side. So when you fall asleep on your left, your stomach is lower and gravity keeps your stomach acid in your stomach. However, if you flip over on your right side, your stomach is higher and gravity is pulling stomach acid toward your esophagus and your throat, and it could cause some acid reflux or heartburn. Back to sleeping on your left side, your heart is also located toward the left, and for me it feels a little more comfortable on my heart and blood pressure when I'm sleeping on my left side. My understanding is that this is because gravity is helping pull the blood back to the heart at the end of the circulatory cycle when your heart is lower from sleeping on your left. So for all of these reasons, to include lower nasal drip and acid reflux, I like to sleep on my left side. Topic 3, Other helpful tips. C, saltwater gargle. This is a quick one. There's some information to suggest gargling with salt water can help loosen mucus in the throat. For me, if I have mucus on my vocal cords, a saltwater gargle doesn't seem to be that helpful, but it certainly doesn't hurt, so in case you want to try it, I wanted to give you the info. Back when we talked about the Neti Pot, you'll recall that we made a mix of salt and baking soda that consisted of 3 parts of salt to 1 part of baking soda, and then we mixed it up. You can use that same mix and you want to take half a teaspoon, mix it with half a cup of warm water. You can even add a drop of honey if you want. Then you can use it as a gargle for 1 or 2 minutes to see if it helps with loosening mucus in your throat. However, I want to mention, if you're having trouble with mucus in your throat, be sure to check out the prior topic on Mucinex, or generic name guaifenesin, because I find that taking Mucinex, drinking water, and inhaling steam is more effective to thin and loosen mucus in your throat. Topic 4, summary and my daily routine. There are a lot of people who have seasonal and year-round allergies, and the allergies can be really frustrating because they can stop you from doing the things you love to do. For me, it's the nasal drip and mucus on the vocal cords and not being able to sing, and I want to practice every day. I want to perform live music, and not knowing if I'm going to be able to sing that night is really frustrating. So for anyone else who is frustrated with allergies, maybe some of these allergy treatment options will help you. Here's our summary table of all the allergy treatment types we covered with my scores of their effectiveness for me personally, and pricing info and medical reference information. If your allergies are really bad, my recommendation is to see an ENT doctor, that's ear, nose, throat, like I did, to get doctor's advice. But whether your allergies are severe and you see a doctor, or they're not as severe and you treat them on your own, I think this summary table is a helpful reference. I found that there was no single treatment option that worked well enough on its own to keep my allergies under control, and I had to experiment with using different options in combination to get enough relief. And you may have to do some trial and error too to see what works for you. Okay, last thing I want to show you is what I do for my daily routine. And it evolves over time, but this is what I'm doing right now. First, I'm still getting allergy shots. After a year of weekly shots, I'm 6 months into getting a year of bi-weekly, once every 2-week shots. And it switches to tri-weekly, once every 3 weeks in the 3rd year. Next, I was taking my antihistamine steroid nasal spray as needed during pollen season, with April being peak in North Carolina, US, but after pollen season I stopped taking it. So the things I'm doing daily right now: I use the ClearUP device 4 times a day for 5 minutes each. I take Mucinex 600 mg bilayer tablets 2 or 3 times a day. I use Neti Pot once a day, and I eat on an intermittent fasting schedule, starting with breakfast at 10 a.m. and ending with dinner between 5 and 6 p.m. This is what it looks like across the hours of the day. I get up at 6 a.m., I do 30 burpees, and I use the Neti Pot to clear out my nose to start the day. I use the ClearUP electronic device 4 times a day, and that includes using it for 5 minutes before I eat my meals. Otherwise, sometimes the meals seem to start up the nasal drip again. The Mucinex 600 mg tablets I take 2 or 3 times a day, starting at 7 a.m. and then again at 1 p.m. and 7 p.m. And when I take them on an empty stomach, I take the tablet with a little milk so it doesn't upset my stomach. Then with the Mucinex, you need to drink a lot of water, and I find that also using a steam inhaler helps it to work. So I'll close my office door and use my steam inhaler over lunch break, and usually one more time after dinner. So as I mentioned, my daily routine is always evolving, but this is what I do currently to keep my allergies under control. Thanks so much, guys, for checking out this allergy treatment video. I wish you success in getting your allergies under control. If you like this video, please hit the like button, and if you want to see more, please hit subscribe and the notification bell.